Hello, everyone. Thank you so much for joining us. We're going to give it a couple more minutes. We'll probably get started a little around 6 o'clock, around 6:02. We're going to let people continue to join over the next couple of minutes, but I'm about to put a poll on your screen that is anonymous. So if you'll go ahead and answer that while you wait, and we will get started shortly. Good evening, everyone. We're going to give it a couple more minutes just for people to continue to join. If you have not done so already, if you will go ahead and answer that poll that's on your screen while you wait, we will get started around 6:02. Thank you so much. All right, we are going to go ahead and get started. Good evening, everyone. My name is Mary Ann and I work for Medtronic. Tonight, I have the pleasure of hosting this webinar where you're going to get to hear from Emily, a PA with Georgia Urology. Emily is a Georgia native and she attended Georgia State University in Atlanta, where she received her Bachelor of Science degree in biology. She earned her master's in physician assistant studies at Philadelphia College of Osteopathic Medicine in Suwanee, Georgia. And she joined Georgia Urology in 2022, and she sees patients at the Canton office. Tonight, Emily is going to be speaking on overactive bladder, urinary retention, and fecal incontinence or stool leakage, as well as a therapy called InterStim that helps to treat those. As I mentioned earlier, I work for Medtronic, and that is the company that developed this therapy. So while you may not know the name Medtronic, you probably do know someone who has had a pacemaker, and that is what we're most known for. So I'm going to pass the mic to Emily in just a moment so that you can hear more about this. But before I do, I want to make a couple of reminders for everyone. Everyone was muted upon entry. If you have a question, please go ahead and type it in the Q&A box at the lower portion of your screen. All names will remain anonymous, but we have disabled the chat function. So please put all of your questions in that Q&A box below. We will answer those questions following the presentation. And likewise, please answer that anonymous poll that's on your screen right now, and there will be a survey at the end. So without further ado, allow me to welcome Emily.
Thank you so much, Marianne. All right, so we will be doing the presentation today. And I think we'll just go ahead here. Like Ms. Marianne was saying, I work for Georgia Urology. I work with Dr. Ludwig up in the Canton office. And we have been working together for about a year and a half now. So it's been awesome. I never thought I'd be in urology, but here I am loving it. So that's great. So before when I was fresh graduate, I was out in the urgent care setting. So that was fun out in the COVID world, and then was looking for a change and decided to interview at Georgia Urology and went up there, and everybody was so great. So started in urology shortly after that, and it's been great ever since. This QR code, which will also be at the end of the presentation as well, just takes you to my scheduling page there, and it tells you a little bit more about me as well, kind of everything we've already been over, where I went to school, what I did before this, all of that good stuff. So it'll be up again at the end of the presentation. You just open your camera, hover over it, and it should put a little yellow box around it and say open this link. So that's what that's for. All right, so let's just go ahead and dive into it. All right, so bowel and bladder control, definitely something that we deal with every single day in urology, more so on the bladder side. So a lot of these statements over here are the things that bring our patients to us. So it's impacting their daily lives. They're not able to go do things they want to do or go to the grocery store. They're having to always wear pads or the adult diapers. And that can be very distressful for a lot of patients. So it's, as you can see by the bubbles, this is an embarrassing thing to talk about. But the good news is as urologists, this is something that they see all the time, every day. So definitely an open topic for discussion with us. All right. Okay, so though very, very common, they're not normal. These bladder symptoms, that the overactivity, the urgency, the leakage, they're common, but not normal. They're usually a symptom of something going on. It's not just inevitable. This isn't something that you just have to deal with. There's multiple options that we can try out and go through, and we'll go through all of those. And like I said, this affects patients' everyday life. This is something that they're not getting enough rest because they're getting up at night. They're having to spend money on pads and those adult diapers. they're changing their diets and things like that to try and avoid any leakage. So definitely a big affects patients' lives greatly. All right, so like we were saying, this is very common, especially in our practice for sure. And as you can see by the bubbles, the bladder control problems are quite prevalent. Okay, so that's 1 in 6 adults have some kind of leakage issues, and then 1 in 12 patients have bowel control issues as well. So yeah, that's there. So, what causes some of these bladder and bowel control problems? Um, some bladder irritants can definitely contribute to these issues. So, things like spicy foods, carbonated beverages, caffeinated beverages, tobacco products, and alcohol can definitely irritate that lining and make some of these issues a little bit worse for sure. The stress in females of pregnancy and childbirth are highly factored into these bladder control issues. And we'll talk about that in just a moment. And then pelvic floor injury, which can happen in men and females. So a lot of our guys sometimes have a lot of pelvic floor dysfunction, and that contributes significantly to their bladder issues as well. Okay, so how does this all work? Basically, your kidneys make the urine. It's drained through the ureter. So if you can see my mouse, kidneys are here, and then they make urine, and it comes down these tubes called ureters, and the bladder holds the urine. Okay, so when the bladder gets about halfway full, it starts sending signals to the brains via your nerves that, hey, we're full. We probably need to get going pretty soon. And then your brain tells your bladder if it is okay or not okay to empty at that time. So this communication pathway is just a big circle, and sometimes there's hiccups along that nerve pathway. So all of our treatments are bladder based, but the InterStim treatment is actually it helps kind of quiet the nerves down to make it less staticky, so that there's clear communication between the bladder and the brain, and it can really help kind of reconnect that pathway, and make it so your bladder's not always signaling your brain, hey, I'm full, hey, I'm full, hey, I'm full, when it's really not. Um, so that's very helpful for that. And then the other thing about the InterStim program, which is fantastic, is it also helps kind of do the same thing on the fecal incontinence side. So how does bowel control work? Kind of the same way. So as you eat, digestive system pushes through food through the intestines, gets into that colon, and once this rectum is full, or it stretches out a little bit, sends that signal back to the brain, hey, we need to go, and then your brain decides whether it's an appropriate time or not to eliminate. So the InterStim device can help kind of calm all of these staticky channels down, so your brain can hear the signals better from these two organs. Okay, so 3 common bladder control problems. So I would say between stress incontinence, urinary retention, and overactive bladder, this is probably more than half of my day, every day that I'm in the clinic. So very common, something that is heavily prevalent for sure. And we'll go through each of these and what they mean. So stress incontinence, that just means anytime that there's pressure in the abdomen, sometimes there can be leakage. So this is your kind of classic, I had a baby and now I have to cross my legs when I sneeze. Any big movements or exercise, anytime that that abdomen can contract a little bit and push on that bladder, you can have leakage. So this is very, very common. And like I said, not normal, but common. And that's something that we see all the time. And we'll go through the treatments and things like that for stress incontinence. Okay. On the other side of that, urinary retention. So that's basically where you cannot effectively empty your bladder by yourself. So it's sometimes you can't tell your bladder's full, and you're overfilling it. And sometimes people do know that their bladder's full, but they're not able to get the bladder muscle to squeeze to empty the bladder. Um, Weak or dribbling stream. That's more for our men, because sometimes we see that a whole lot when there's an obstruction from their prostate, and needing to use a catheter to help empty your bladder. So if the bladder's not functional and things, you're not able to empty the bladder on your own, the risk with that is that that urine starts to back up to those kidneys, and then that can cause damage if those kidneys stay swollen with that urine. So if the bladder's not able to empty, we have to help it, and that's with the use of the catheter. It's not ideal, but sometimes we just have to do what we have to do to protect those kidneys for sure. And then back to like the weak and dribbling stream. So men have an extra or another organ called a prostate, and that sits between the bladder, right under the bladder and before the urethra to eliminate the urine. So sometimes that organ can grow into that middle channel and kind of pinch off the hose that it's used to empty that bladder. And so sometimes we see that that prostate's getting in the way, and then it's causing our guys to hold on to a lot of urine that can put you at risk for UTIs. And the more you stretch that bladder, and that bladder has to work to get that urine out past that prostate, the weaker it gets. So definitely something we assess as well for our guys is just to make sure the prostate isn't causing any of these retention episodes. All right, an overactive bladder. This is something we see all the time. And so this is let's all define urge incontinence first. So where stress incontinence or stress leakage was any kind of pressure causing the leakage from your bladder, urge incontinence is the leakage that you feel like when your brain gets the signal from your bladder and says, oh, I have to go, and that bladder starts squeezing without receiving a signal from your brain to go, okay, this is an appropriate time. It just starts to squeeze anyway, and you start to leak before you get to the bathroom and it's appropriate. This can be after drinking small amount of liquid. You just get that signal going, and it just won't stop. And then we see a lot of our urge incontinence or urge leakage folks using those pads and those adult diapers frequently. And then the urgency and frequency, frequent and uncontrollable urge to go, very, very common with overactive bladder. And then these are some of the things that you're going more than 8 times a day. That's a whole lot. And that's definitely impactful to people's lives for sure. And then feeling like your bladder's never empty, meaning that we have to decide, is it actually empty, or we're going into those retention episodes and things like that. But if you're emptying your bladder but you just don't feel like it's empty, that's an overactive bladder symptom for sure. And then like we talked about before with the going frequently and 8 times a day, it's also taken into consideration the nighttime awakening. So anytime you're getting up more than 2 times a night, that's technically considered that overactive bladder. If there's no other cause and we're emptying our bladder okay and things like that. So these are some of the symptoms that bring patients to us, and it's our job to work up and give you options as to what comes next. Okay. Fecal incontinence. So that is the leakage of stool. Okay. So same kind of things with the urinary incontinence. So it's an ability to regulate when you go, or there's stool present every time you urinate. Again, we're using pads or those adult diapers to protect us from the cleanup. Okay. Okay, so this is a simple kind of pathway, and I attached our Georgia Urology one that um, we use next. So these are kind of the 3 steps. So there's lifestyle changes first, oral medications, and advanced therapies. Let's go to the next slide. So if you were to come in for any of these symptoms, likely you'd be getting one of these pieces of paper. And so we start up here at the top, the evaluation. That's that initial visit. We sit and talk through your symptoms, what you've tried, what you haven't tried, and anything that might contribute to it. Up here, we see our more lifestyle modifications that we can do. Bladder training, just training that bladder to hold just a little bit more. Seeing if we can hold off 5-10 minutes before going to the bathroom to teach it just to kind of calm down a little bit. Pelvic floor muscle training. So that can be anything from pelvic floor stretches to Kegels to pelvic floor physical therapy. So lots of different things we can do there. And then fluid management, like before, some people already come in trying to do or have already tried this, where I've cut out caffeine. I only drink a little bit of water a day just to try and mitigate the trips to the bathroom. So we start there. This is usually all in one visit because people have tried most of these things on their own anyway. So likely we start to talk about medication 1 or medication 2, or if you're not a candidate for those medications, and we'll talk about that. We start to kind of move down this tree, and then we're talking about Botox, bladder Botox, the InterStim, neuromodulation, and PTNS. That's the shorthand for this fun little box right here. So we'll go through all of those, but we're really going to focus on the neuro modulation. So on the back of our sheets, we have voiding diaries, and these are very, very important. So if we go back here, if we're starting you on medication 1, usually what I'll do is I'll have you do a baseline day. So no medication, and do a diary day. And then once you've started the medication, and a week or 2 afterwards, do a repeat one. And then you pick the 3rd day. So we can kind of get a comparison to see what's going on. It's really good to just kind of write down what your bowel and urinary symptoms are on paper. So we can kind of compare day 1 or day to day what's going on. So those are the 2 Georgia Urology papers. We really like using them. And it gives us good data to see if things are getting better, if they're staying the same, how you're doing, things like that. All right, so more about lifestyle changes. Like I said earlier, the diet, so those bladder irritants are they play a large role in it. So if we're drinking 3 pots of coffee a day, yes, we're gonna go to the bathroom a lot because that's a lot of caffeine, and that can open up those blood vessels, and it acts as a diuretic, so it makes you urinate more. Exercise, those are those Kegel exercises and things like that. And then bladder and bowel retraining. So that's called biofeedback. That goes right along with like pelvic floor physical therapy and things like that. And then the Kegels, of course. So like I said, a lot of patients have already kind of gone through these. These are easily searchable on Google. So a lot of patients try and fix this for themselves. And after these don't work, that's usually where we come in. So oral medications, they can be great, but we have a lot of kind of speed bumps to get this to work for patients. Okay. Um, this is kind of like a Band-Aid. They don't um, they don't fix what's going on, but they can help with the symptoms. Um, they're taken daily, absolutely. And some of the medications in this class can cause some of these side effects. So dry mouth, blurry vision, constipation, hypertension. Um, and with our older folks, it's definitely something we have to keep in mind, because there's something called the Beers criteria. And some of these medications like the oxybutynin and things like that can cause a little bit of confusion, put patients at higher risk for falls and things like that. So we try and stay away from those older generation medications. There's a couple newer ones that don't cross through that blood-brain barrier, don't give you that side effect, but they're very expensive. So another speed bump we run into is getting medications approved through insurance. So it's great if we can find something that works well for you, that doesn't give you the bad side effects, but we really try and stay away from those older generation ones. There's actually been a couple studies done where some of our older patients are at higher risk for development of dementia on those older generation medications. So again, I'll just say that we try and stay away from those at all possible. And we just want to get you feeling better, but not put you at risk for anything serious like that. And so this is kind of a sad slide, because a lot of the times patients will come and they present for visits, and then they're given one medication. It doesn't really work all that well, and then they don't follow back up, which is kind of theme of this slide. The good news about Georgia Urology is we have nurse navigators, which is wonderful. So if you come in for these symptoms, we just hit a little button, and it helps us keep track, just to make sure that, hey, if you don't like the medication, this nurse is going to give you a call. You can tell her all about it. They send a message to me, and we'll either meet in the office, or we can try another medication. Or if you're ready to talk about the advanced therapies, she sets up an office visit. So it's a really good kind of flow to make sure that everybody's getting the care they need, and making sure that you don't lose hope for it. So, and again, you get that yellow sheet that kind of has our pathways on it. So you know that one medication isn't the only option for you. So that is there. And then, so our advanced therapies, this is where we're going to talk about Medtronic and the InterStim systems for sure. And some of the other options like Botox. Okay, so bladder Botox, this is done on the back of the bladder wall, and I put a little picture up on here so you can kind of see what I'm talking about. So we do this in our outpatient surgery center, and a scope is used to insert the needle up here, and the surgeon or the doctor will go through and inject Botox on the back of this bladder wall. That just kind of calms that bladder down a little bit, just to relieve some of those symptoms. This is the same Botox that people put in their faces. We're just putting it in a different spot. Does the same thing to kind of calm that bladder down. With this, you do have to repeat every 6 to 12 months usually. Some patients it doesn't work for, even after we do it, they're still not improved right afterwards. And there's some people that this lasts 18 months or more on. So it's just all very person dependent, and how fast your body metabolizes that Botox. Before we do bladder Botox, we always get what's called urodynamic testing, and that is basically we need to make sure that this bladder muscle is strong enough to withstand the Botox, because the Botox does put you at risk for urinary retention or inability to empty your bladder, because we're putting a Botox injection, which basically freezes the muscle. Sometimes if the bladder's not strong enough, it can't withstand that, and then it can't pump on its own. So thankfully, I haven't seen that happen working with Dr. Ludwig, which is great, but it's definitely something we talk about with everybody who's considering this. So urodynamics is a test to make sure that your bladder's strong enough, and it can help us diagnose exactly what's going on. So it's a great test. There's a small catheter that's inserted into the bladder, and they fill your bladder up with the sterile water, and it can measure pressure. So health of the bladder, and then what kind of leakage you're having, things like that. It's really, really good. So like you saw in that flow chart, usually a lot of our patients are getting that urodynamics even prior to the InterStim and things like that as well. Right. And yeah, one study found that about 70% of patients discontinue treatment after their first Botox. So we have a couple patients that absolutely love it, and then we have some patients that we do it and then it doesn't work. So it's hit or miss. It just depends on who you are and how you respond to it. Okay, so this is the percutaneous tibial neuromodulation. We call it PTNS, percutaneous tibial neurostimulation. And this is basically a fancy word for trying to turn on that nerve again. So the nerves for your bladder come out from your lower back, enter or go to your bladder, and then travel down your legs. So the science behind this is we're trying to we insert a little needle, an acupuncture needle, right in that nerve, and we attach a little bit of electricity to it, and it tries to kind of calm that static down from a distance. So this can be good for patients that don't want to go through surgery and don't want the risk of the bladder Botox and things like that. For me and Dr. Ludwig's clinic, this has been a really good kind of trial for the InterStim, which we'll talk about more. So if we get a good response down in this nerve all the way down here, and we'll look at it in the next slide, the InterStim basically does this 24/7, 365 days a year. And it's if we can get good results here, usually our patients absolutely just love the InterStim implant. So downsides to this, obviously we're sticking a needle in there, so risk of bleeding and infection is there but low. And then the time. This is a very time intensive treatment or therapy. So each session is 30 minutes. The initial sessions are for 12 weeks. So for 12 weeks, you're coming to see me in the office. I hook you up like this. You sit for 30 minutes, we pull that thing out, and then you go about your day and you come back next week. So it's once a week, 30-minute sessions for that initial startup period. And then after that, it's monthly. So this needs to be done frequently. So that kind of gets in the way for some people who really like to travel, or they're not in our area all the time. So that's a limiting factor to the PTNS. Yeah, just the coming in every either week or month kind of determines whether patients can try this out or not. And then what we all came here for, the InterStim sacral neuromodulation system. So like you can see over in this bubble over here, this is basically a diagram. So this is the back of the person. There's nerves that come out from your lower back and your sacrum low down that innervate the bladder. So we put a wire or a lead right next to it. And it gently wakes up that nerve and gives that bladder nerve some stimulation. Okay. We have seen just phenomenal results with this. A couple patients went from going to the bathroom like 15, 16 times a night or during the day to half that or better, it's fantastic. So those patients, we started doing PTNS, tried it out. Yes. And then the great thing about this is we don't just take you straight to the operating room for this. Dr. Ludwig will put in a temporary lead and an external battery. So basically, oops, you get to try it out for about, we usually leave them on for about 7 to 10 days, and see if it works well for you. And he puts leads on both sides, so we see which side works well for you as well or better. And you'll be filling out a bladder diary during that trial. For the trial, you're not under general anesthesia. Dr. Ludwig will numb that area well. He'll place the leads and then you go home. And the Medtronic reps will walk you through how to kind of program it and try it out and see if it's going to work for you. After that, usually you meet with either me or Dr. Ludwig, and we go through it again, see which side worked, did it work for you? Which side was better? Are we ready for the permanent implant? Usually the answer is yes, and that turns into a pre-op appointment. So it's really gotten to be very streamlined, and it's really great because patients love doing the trial first just to see if it's going to be worth your time and money, which is completely understandable. But we've had great results with it. I think that's all I've got for this. And like I said, basically it's calming down that static. If you think of like TV static, it's like turning that down so you can talk to the person next to you a little bit better, and understand them. So basically it's based doing just calming everything down, making that pathway more clear for that bladder and that brain to communicate much better. All right, so this is kind of just a summary slide of uh, just people really like it. So I know Dr. Ludwig's done a whole lot of these. We've done a lot of trials that do end up in permanent implants, and patients just absolutely love it. They get back to their normal lives. They're able to go to work much easier. They don't necessarily have to buy their pads or their adult diapers anymore. And they're very happy with it. So all right, so this is the example of what that little external battery is like. It's just a kind of like a belt that you put around yourself, and there's a little battery pack in here, and that's hooked up to 2 wires, and it's all secured to your back. And you can do the trial for up to 14 days or 2 weeks. We usually do about a week to 10 days, depending on when it gets placed and when we're in office and what we need to do from there. Um, the temporary leads are removed during that visit. And usually we don't even need band-aids or anything like that to take those out. It's not uncomfortable or anything like that. So it's amazing. They really have a good system to try it out and let you kind of experiment with it first before we take you to the OR, which is under general anesthesia for the permanent implant. Major question that we get asked all the time about this device is it MRI safe? And absolutely it is. There is so when you have your InterStim, they'll give you a little cell phone basically, and their app is installed on it. Probably takes 5 or 10 seconds to get it turned on to MRI mode. Very easy. And this has been great because we have a lot of patients like with multiple sclerosis and things like that need MRIs pretty regularly, are still able to get them and have this device to help them with their urinary issues. So this has been great. So it's been a concern for patients, but this has been amazing, and we've been able to still implant in patients that need regular MRIs and just frequent monitoring. All right, so is that InterStim right for you? So when you come into the office, if you're having all those symptoms and it's just highly affecting your life, you're not able to do the things you wanted to do. We've tried the lifestyle, we've tried the oral medications, or you're not a candidate for the oral medications. If you are and the oral medications aren't working, then yes, the advanced therapies would be our next step. So this is a little bit of the just the data behind the InterStim device, and patients love it. They really, really love it. And it can really, really help also with that fecal incontinence, which goes along sometimes with that urinary incontinence or leakage as well. We have a couple patients that have had both, and that InterStim device has helped significantly with both of those. So you can see by the data that patients just absolutely love it, and it really does work for bladder and fecal control. This is a quote from a patient. All right, so this is questions time. This box right here is my attending physician, Dr. Ludwig. He's the surgeon, the urologist. He does the PTNS, or the trials for the InterStim, and he places the InterStim devices in the operating room. And he sees you in clinic and all of that good stuff as well. I do more of the PTNS, and I get you ready for anything that he's doing in the OR or with that bladder Botox, and we work through medications and things like that. So if you do the QR code, this is his right here, this is mine. We're both more than happy to talk with you about any questions or anything that you may have.
All righty, well, we are going to go ahead and get to everyone's questions. Continue to type those in as she goes through the ones that we already have. And thank you so much for everyone staying engaged and listening. I'm going to make a quick announcement too about that QR code. That is going to be the most effective and quick way for you to make an appointment. So like she said, if you'll just open your compatible device, whether it's an iPad, iPhone, Android, you will open that up, you'll scan the QR code, and then there will be a banner that will pop up when you do that. If you click on that little banner, it's going to direct you to the scheduling window. And when you are asked for the reason for your visit, you are going to want to designate webinar. So you can either type webinar in as the reason for your visit, or you can also go to the website and there's an orange schedule button in the corner, and you can do the same thing. And again, when prompted for the reason for your visit, go ahead and type in the word webinar. That's just the most effective and quick way to make an appointment. So now we'll go ahead and get to the questions. So we have one person that asked, cost or options, does Medicare cover this? And this was during the InterStim portion.
Gotcha. Yeah, so most of the time we're finding that it's very well covered, especially if we've worked through that algorithm where we've tried this and that, and you're not a candidate for the medications, and we follow the steps, and most of the time it's well covered for sure. The good thing about Georgia Urology and things like that is they'll let you know exactly how much you owe prior to having the procedure. It all goes through insurance and things like that, so you know what to expect.
All right, our next question is the S&M device for bowel and urinary control. It sounded like it was more for bowel control.
The
InterStim.
So it's for both. It is for both. It's definitely got crossover there. And we, as urology, we use it more for the urinary because that's what we see most frequently. But a lot of our urinary incontinence folks do have the fecal incontinence component too, and it can help with that as well.
All right, we had someone ask, is there a BMI max for surgery?
So that I don't know, but I haven't run into that yet. I think it would all have to do with anesthesia, most likely. because the InterStim itself goes in the same spot in everybody. So unless there's an anesthesia component to it, I have not heard of that.
All right. A couple of more questions. How many medications do I have to try, and for how long until I can move on to one of the more advanced therapies?
So that all depends. So if you meet that Beers criteria, we're in our more mature years. Sometimes we're not even a candidate for those older generations. So sometimes sometimes either there's medication interactions or we have other things that we can't put you on medication. And sometimes it's an insurance issue where they want you to try at least 2 or 3 medications or something like that before moving on. But the good thing is that nurse navigator, and we have that will check in on you and everything like that. We'll work with you and let you know exactly what we're seeing on our side as far as insurance or what we need to do next to get you to that bladder Botox InterStim PTNS level.
We had someone ask, I have done a 12-week session of PTNS. I have seen some relief, and I was able to get off one of my 2 medications. I've had some relief, but I'm still not where I want to be. What would you recommend?
So for that, if you've had some results with that PTNS, I would highly recommend trying the trial of the InterStim. The PTNS is great, but it's once a week or once a month. So if you're getting results with that, the thinking is that you would have really good results having that nerve stimulated at a closer site as well as all the time. And like I said, that trial is temporary. So if you find that it's not doing anything more than the PTNS and you don't want to go through with the implant, we just go back to PTNS. So it's a really good trial just to see, is there any more improvement that can be made?
All right, another one. What was the surgery like, and how was the recovery?
The trial we went through, that's completely outpatient. That's done just while you're lying on your belly, and Dr. Ludwig will numb up that area where he's putting the leads. You go home and you trial it. You go back to your normal activities, usually the same day or the next day. The actual implant surgery is also outpatient, but that's done in the OR under general anesthesia. So usually feel pretty groggy after that. There's about an incision about probably 2 inches or so or less that usually is sealed with glue and covered up. So not a big incision or anything like that. Entire procedure probably takes about 30 to 40 minutes total. So shorter procedure, very small incision. Most people can start to do their normal daily functions like the next day or so. Probably still feeling pretty groggy from the anesthesia, but you just advance your activity as tolerated. But we haven't had any issues where patients are out for more than a couple days.
All right, we had someone ask, how do you know when it's the right time to try a new treatment option?
So that's all up to you. If you're on a treatment and if your symptoms are not where you want them to be, or they're not getting better or improving quickly for you, then that can be a opportunity to either talk to your provider or the nurse navigator and say, hey, I'd like to discuss other options. If it's a medication that we're trialing, usually we usually give like a 4 to 6 week window to try that out for you to get the full effect. PTNS, that's that 8 to 12 week mark is usually where your symptoms will level out for PTNS. And then bladder Botox, it's just patient dependent.
All right, we had one more. What if I've already tried Botox? Would InterStim work for me?
Yeah, absolutely, absolutely. So Botox is working on the muscle, not the nerve of the bladder. So sometimes we just need to have better communication with the bladder and the brain. And we have a lot of patients that say, you know what, Botox didn't work all that well for me, or I don't want to keep going in for this. And we kind of go forward with that neuromodulation route. So definitely an option. And if we try the PTNS or something like that and it doesn't work and you want to repeat the Botox, it's not limiting. Once you try one, you can still go back to the other if that works better for you.
All right. Well, as of right now, we don't have any more questions. So if you have another one, go ahead and type it in. We're going to start wrapping everything up. But first and foremost, I just want to say thank you to Emily for hosting this event with us tonight. It was extremely informative and we're so grateful for your time. And thank you to everyone who joined us and for all of your great questions. Regarding appointments, just one more time, like we said before, you'll just scan one of those QR codes with your camera, click on that banner that pops up, and then when prompted for the reason for your visit, put webinar into that spot. That's the most effective and fast way to make an appointment. So be sure to do that. It will also be included in the follow-up email that comes out from Zoom along with the recording. But much of what we discussed tonight really is relevant to so many of you, but each and every person is unique. So it's always beneficial to make an appointment. And if you don't mind, go ahead and answer that poll on your screen if you have not already done so. We are going to email you the recording and we'll email you the scheduling link as well and some video resources. But thank you again to Emily and thank you for everyone who joined us. Good night.
Good night.